Sponsored by White Mountain Fire and Life Safety. Today on the show we have Darcy McKee with the Chronic Disease Self-Management Program with Navajo County Public Health Services District. Welcome to the show, Darcy.
Thanks.
So how long have you been with the county?
I have been with Navajo County 27 years.
Wow. How long have you been with chronic disease?
Oh my gosh, I wasn't ready for that.
Nice.
I'm going to say I've been in chronic disease for 9 years.
Wow.
So since it's been funded, and it's either been 9 or 10 years.
Wow, that's a long time to be with the county. That's a long time to be with the program.
It is.
And you know, the back, like the back of your hand now.
Except for it changes frequently because chronic diseases are never the same. So as soon as you think you know it all, it changes.
Oh, dang it.
Right?
So what is chronic disease?
So chronic disease is pretty much anything that is not what we call an acute. So if you have a broken arm, it can be fixed, it heals, you're done. A chronic disease is something that's never healed. So it's treatable, but it's not healed. So you can never get rid of it. So a lot of times we encounter people who are diabetic, for instance, and we'll talk to them about chronic disease self-management and they'll stop us. No, I don't have a chronic condition. I'm a diabetic. So people don't relate the two together. So we do a lot of education. It seems like we're really educating people that chronic condition can be anything. It's high blood pressure, high cholesterol, it's arthritis, it's diabetes, it can be cancer. So any number of things from very minimal to really severe.
Wow. And you guys know about them all, or how does that work?
So we don't know about them all. So we call our program Healthy Living.
Okay.
And so it goes by a lot of things. You may hear like chronic disease self-management, CDSMP, CDSME. There's a lot of different acronyms for it. So really, to sum it up, we just call it Healthy Living.
Okay.
And what it is it's a program that's been founded out of Stanford. So it is a best practice and an evidence-based program. And when we teach the class, we kind of teach an overall. So CDSMP is really the umbrella for chronic disease self-management. And we cover different things to live a healthy life. So you build skills and you get tools to manage chronic conditions. So it can be any chronic condition. And a great example is if you had arthritis and it starts to flare up, you're going to have pain. The pain can cause fatigue. So we talk about those things. Those are the actual symptoms that you're getting from your chronic condition. So what can I do to relieve my fatigue, to help relieve my pain, to then work for the treatment of arthritis? So we don't try and treat your disease. We teach you how to manage it so the treatment is successful.
Because like you said, with a chronic disease, it doesn't go away.
Right.
You're going to have that for the rest of your life.
Forever.
So you might as well figure out how to manage it so that you can have a happy life.
Exactly.
Because if you're not managing it, you're just going to be more depressed, or it's not going to,
Right. And depression's a huge thing that we see in various different severities of it. Sometimes people are just depressed because they have the pain or they're limited in what they can do. So one of the things we do is we really work with them to build back up their activity levels or find other activities that they can do that doesn't make their condition worse.
Okay. And so this is a course that you guys teach, correct?
It is. So it's a 6 weeks course. It's 2.5 hours once a week. There's a 20-minute break allowed in between the time so that you're not just sitting in a chair or at a table or something for that whole time. And each week we teach different subjects or go over different topics. So throughout the 6 weeks course, you are getting information, building skills, receiving tools to go over about 32 different topics.
Oh, that's a lot of topics.
It is.
Wow.
So, and it runs really smooth. So we do things like brainstorming, action planning. So some of those things that we teach you are to help you take small steps, because you can't climb a mountain without taking that first step. And that's really what it is. The brainstorming, the problem solving, action planning are looking at what is your goal? What is that big picture? And then how are you going to take the small steps to reach that big goal?
Yeah, and you guide them.
We do. We walk them through it.
And that's nice, because then they have somebody they can ask questions to, and they have that support.
Right.
Now, you have partners that you do this with, correct?
So we co-facilitate. So we have to have 2 facilitators. So up here in the Show Low area, we partner with Summit. And Kristen Connor with the Occupational Health and Employee Health at Summit has been phenomenal at partnering with us and getting us into areas that we weren't able to. So part of our chronic disease self-management, we have very specific topics. So if you're diabetic, there's a class just for diabetic patients. There's a class just for pain management. So Kristen has worked with the hospital team and built the referral system. And the doctors can then refer to our clinics or our workshops, and we will start the classes from there. If you're not a patient, or if you're not having a need to go to Summit and you're interested in one of the programs, because it's also a great preventative tool, or it's a great tool for a caregiver, so that you're kind of understanding what the person who has the chronic condition is going through. You can always go into the occupational health building, where I think it's Serenity Spa, and talk to somebody right there, and they can get you set up with the class as well. So you don't have to see a physician.
Oh, wow. That's
Yeah.
nice.
And so in the area, we have 6 trained lay leaders who can teach those classes. And so our hope is that we'll have them pretty regularly, even if it's different topics. So I really want to make it clear that CDSMP covers all chronic conditions. So if you're a diabetic, if you have pain, if you have arthritis, you can get into that class and you're going to receive very helpful, very useful tools to really treat your condition. If you're a diabetic or you need pain management, there are very specific classes available, and you can just either call myself at the health department or call Kristen at Occupational Health at Summit.
And then you also partner with Apache County to do Spanish, or?
So we do. Apache County offers the Spanish version of chronic disease self-management, and we offer that once a year. If you're interested in a Spanish version, you can either get in touch with Apache County Public Health or with us here at Navajo County Public Health.
And some other chronic disease include like emphysema and?
Emphysema, COPD.
COPD. Okay.
Anything that you think could be a chronic condition, we encourage you to come in.
Especially if you are on a pain management deal, because if you're not managing it, you're just going to ask for more pain meds.
Exactly.
And what kind of life is that to be doped up all the time? I mean, I don't know a proper way to say that. I could have picked something else, but I mean.
And really, medication is just a way of kind of covering it. It's not helping it. So one of the things that we've seen with the pain management class is you start out with maybe ibuprofen. And after a while, ibuprofen doesn't work. So you go to your doctor and you get Tylenol 3. Then Tylenol 3 no longer works. So you go to something stronger, and that doesn't work. So eventually you're going to cap out. You're going to take pain meds, and they're not going to work. So now you're finding yourself taking twice as much, 3 times as much, because your body becomes immune to that medication over time. So learning to manage that pain in a healthy way without pain medication or with minimal pain medication is one of the best things you can do. And a lot of the times it's just things like looking at your diet, physical activity. And a lot of times people think physical activity makes their pain condition worse. And it's not physical activity that's making it worse, but perhaps the exercise you're doing that's making it worse. So we look at that kind of stuff. We teach you about really looking at it in moderation. Instead of doing 30 minutes all at one time, do 5 minutes several times throughout the day, because that's still going to give you the same benefit as if you're doing 30 minutes of exercise.
Yeah.
And it's healthier for your muscles if you're in pain or if you have a condition that's not allowing your muscles to take that impact or that physical activity. So,
what age is usually good for the course?
so chronic disease self-management is good for anybody who has a chronic condition. So we really can't put an age
Okay.
on it. Obviously, if it's a minor, a parent or a guardian would have to attend with them. Usually over the age of 18 is what we have serviced. Our biggest age group that we see is actually 45 to 65. That seems to be the group that we target the most, or we have the most referrals for. And I'm not really sure what that is. I don't know if it's a generation of maybe they don't want to take as many pain medications, and so they're really excited about learning a different alternative method to just popping another pill or something. Or maybe the older population just isn't being reached with our advertisements or our media and stuff. So,
and then you guys also focus on another course, right? Matter of Balance?
we do. And Matter of Balance is great because it kind of goes hand in hand. Matter of Balance is a fall prevention, but it's also a great course even if you don't have the fear of falling yet. It's a good preventative tool. But one of the things we do is we teach exercises throughout the 6 weeks of Matter of Balance. And those exercises are very minimal. So if you're maybe more unstable on your feet, so you're in a wheelchair or you can't stand for long periods of time, the exercises are really geared to any level. So you can do chair exercises. We also teach it like you can stand and use your chair for some support and stuff. So Matter of Balance is a really great program to kind of support what we offer with chronic disease self-management. We do Matter of Balance. We also partner with our counterpartner in Apache County to do Matter of Balance across the counties, and we offer them throughout Navajo County. So,
And do you get a lot of requests for that one, or?
we do. Some of the benefits to Matter of Balance is we don't have to have a minimum number of people. So chronic disease self-management is a phenomenal program, but because it's an evidence-based program, we have to meet fidelity. So we have to have a minimum of 10 to 12 people in our class. If we don't, we have to cancel the class. And unfortunately in this area, it's kind of hard to get that number and to maintain that number. So Matter of Balance is a great alternative because we can teach it with 2 people.
Oh, that's nice.
So it's a benefit program that's really going to build your muscle, build your strength. You're still going to get a lot of great information from it. And we encourage people to find resources. They're given a topic each week, and then you can find resources to bring in and share within the group.
Oh, that's smart.
Yeah, so it's kind of a networking. And then we have training and skills through not only the chronic disease self-management, but through other just topics and stuff that we teach at the health department. So we can also offer resources. So.
And being as rural of a county that we have, it's nice that you do have those partnerships in other areas to reach across the county.
Right.
And then I can see how sometimes the CDSMP course can't get that number because you have people coming from far distances.
Well, and one of the other things that we find is we have the people who come in because it's too hot in Phoenix, or we have the people who come in because they want the skiing season, and they're not here for the length of time that's required for that class. So they attend 2 or 3, they may be here for 4, but we never are able to keep them the whole time, which why our partnership with Summit is going to be so phenomenal is because those are established people. They're patients of doctors here on the mountain. And so that referral system is built into their medical record. So it kind of closes that circle. The doctor can refer, we make the contact and get them into a class, and then we can report their progress right into their medical record. So it's a full circle tracking. So that partnership is going to be great for us to fill those numbers and to get those classes. And then again, once we know we have 10 or 12 referrals from doctors, we can also bring in the outside community who's not a patient or associated with Summit. It's not something that's just for Summit patients, but it's a good way of getting that number that we need to offer those courses.
And do they cost anything?
They are free of charge. You receive a healthy living book with them that then you get to keep afterwards, which has hundreds and hundreds of tips and topics that you can cover that we either don't touch base on through the program we're offering, or we barely just skim the top. So a perfect one for that kind of combines the two programs of chronic disease and matter of balance is there are 4 chapters in there of nothing but exercises. And it talks about simple exercises that you can do from a chair to more strenuous exercises that are like sit-ups and push-ups and stuff. So it gives you 4 chapters on exercising, where in either program with chronic disease self-management, we barely touch on that, maybe do a few little exercises. It's probably a 20-minute. Or matter of balance, where we offer it for 6 weeks for 1 hour at a time during the week. But this really exceeds that and gives you so much more. So once you've kind of managed and learned what we have taught, and you're ready to take that next step and have a little more resistance, it gives you that information in these books.
Which is nice because you get them to start and they can continue.
Right.
And
Right.
that's important when it comes to managing a chronic disease or staying on top of your feet.
It is. And we always say, no matter how slow you go, because we have people who come in and say, I just can't. I can't even hardly walk to the mailbox and back. So our kind of motto is no matter how slow you go, you're lapping those on the couch.
That's awesome.
Only if you can only walk from your couch to the front door and back, you've done more than if you'd have just sat on the couch.
Yeah.
And so we give tips like that, during a commercial, stand up and just walk in place for a little bit and sit back down, or walk from your couch to the mailbox. And then after that becomes easy, walk to the neighbor's mailbox. Once that becomes easy, so we really teach you how to progress, because sitting doing nothing is really not going to benefit you at all. So even the smallest amount is better than nothing at all.
Yeah, it's funny that you brought that up. People are just having trouble walking. I'm like, just the other day he was on my sciatica, and I was like, I can't. It's not a chronic disease because it'll go away. But I'm like, oh, I had such a hard time walking. I was like, I need a little walker.
Yeah, and those are some of the things. It's funny that you mentioned that, because in your condition right now, yes, of course it's going to go away, but you may have trouble. Every now and then you may just catch that little hitch or something, and so the matter of balance would be a perfect, because there's a lot of stretches that we teach that you can just stand up behind your chair at work and do, or, at home with your kids, or even once you've had the baby, there's just some exercises and stretches that you can do with your child that makes it fun and that helps build both stamina in you and the child.
Well, that's good that you bring that up, because a matter of balance, I'm thinking it's for the older population that fall a lot.
Right. And that's kind of the stigma around it, because it is a fall prevention, but we all are at risk for falls. I know there's been times that I'm not paying attention and I'm in a hurry and I'll trip over my rug, or I wear heels a lot, so I'm always constantly turning my ankle, or different things. And so even though it's a fall prevention, it's really a great course to build those core muscles. So, your strong muscles in your legs, in your abdomen, and it builds stretching so you're more flexible, you have better balance, so that you're not falling. So, I might stumble over my rug, but I'm not going to completely fall because I've built some balance through my core muscles. And so, it's a great program for preventative, not just to help you not fall. So I encourage anybody to take it. Like I said, it's great because you can do it from your chair. There's times at my office I'll just be sitting and think, my neck is really tight. So I can do 2 or 3 little exercises. It takes 5 minutes and never stand up, never get out of my chair. I can do it on the phone while you're on a conference call, So there's so many great benefits that people don't think about, because the stigma around these programs have always been for elderly. Mm-hmm. And that's one of the things we're really trying to get away from, especially in this area where we have a lot of active adults of any age range, that we really want to encourage, use these skills and you build these knowledge that you can get for free and use it as a preventative measure, so that you're not needing it when you are 65 or when you're 85, or, keep it as a preventative tool.
Yeah, you can avoid that chronic disease somebody falls and they break their hip and they're younger.
Right.
Now you might end up having a chronic disease that could have been prevented by having that stability.
Exactly.
And
exactly.
Yeah, I've never thought of it that way. That's a good point.
Yeah, it's a great preventative tool. And like I mentioned earlier, it's great for caregivers because a lot of times they lose patience. They don't understand why maybe the person they're caring for who has the chronic condition is so cranky or sleeps all the time. And by going through the course, they're going to build a toolbox to help them understand what the person with chronic condition's going through.
Wow.
So
yeah, I'm like, oh, I should look at some of those exercises, Darcy.
Come on, I'll teach you.
I know. I might need a little bit of help because honestly, I'm like, my body is just so stiff with this little thing.
Right.
And being older, I remember, being pregnant younger, I was okay, I go hiking all the time, walking, it was no big deal. And then Alice, the second one, I'm like, okay, I'm, mid-30s, and now I'm going into my late 30s, and I was like, geez, Louise, it's tough to walk.
It is. And, we don't think about the strain that we put on our body through pregnancy, through just everyday thing. I know I was at work one day, and I was carrying some big boxes, and never thought anything of it. I do it all the time. And the next day I was so sore and I'm thinking, why am I sore? But the stretching, I don't stretch the way I should. I don't use my muscles the way I should. And so, you're a perfect example. You're still very young, but you're already sore and you're feeling the difference from the different pregnancies. And so Matter of Balance would be such a perfect program for you. And, I encourage people all the time, bring your friends with you. Like if you're interested, bring your friends who are in the same age group with their children, and we'll teach a class more for families, like mommies and little kids. And
that's cool.
That way you don't have to worry about daycare. And we really try and be flexible and tailor the program to the participants, because it's not a benefit for us to have all this knowledge and all of this information if we're not giving it to our residents or providing that service. And we can't provide the service if we're really structured and, oh no, you can't come if you have children. So we encourage, I encourage you to find 4 or 5 people that want to come and want to learn, bring their kids. We'll do the physical activity. We'll make it fun, and we'll encourage the kids to be physically active as well.
That's a good idea.
So, yeah.
Yeah, I like that, because then you're not always doing, the elderly need it, yes, but
right.
I need it too.
Exactly, and that's the thing. Anybody can benefit from Matter of Balance. Anybody can benefit from any of the chronic disease self-management programs that we offer. It's finding the click that is going to work, because it's not going to work for a mid-30 person with their children to attend a program with a 65-year-old or an 85-year-old. So bringing those groups together and encourage them to bring their friends with them, because 1, it makes it more fun. 2, you're more relaxed when you know the people in the group, and so it's easier to learn because you are more relaxed. But then if you're in there with your children, you're not sitting there trying to focus on what's going on and worrying about, did my kids get dinner and who's babysitting and what time is it because I've got to get there to pick them up, kind of a thing. So, that way if it runs over a little bit, you have your kids, it's fine.
And is that a 6-week course too? Or
it is. It's 6 weeks. And we can alter that one. So all of our programs are very flexible, except for chronic disease self-management, which we have to meet the fidelity. So it's the most structured. But we can offer Matter of Balance twice a week. We can do early mornings. We can do evenings. We can do lunchtime. So that one's a really flexible program for people. And it's a lot to ask somebody to commit to 6 weeks. So we try and make it very worthwhile. We try and make it fun, because it is a large commitment. And we know that everybody's busy. So with Matter of Balance, where we don't have to be so structured, if we offer it twice a week, we're only asking for 3 weeks of your time. And because we can do it more on a flexible schedule, we can offer it in the morning or at noon, whatever works for you. Bring your kids, invite your family, kind of things. So
that's really awesome. And how many hours is it?
So it's 6 hours. That's all you would attend. So
it's an hour every.
It's an hour course.
Oh, wow.
Now it does run over sometimes, but that's based on the participants. So the actual exercise program itself is 45 minutes, and then there's some information that we give out before and after to really help build that exercise up and to encourage you to continue throughout the week or in between the two programs that we're offering. So, but it's an hour of your time.
Yeah.
So,
It's nothing, and it's worth it.
Yes.
Because in the long run, definitely.
Yeah.
So, where would they contact you for either one of those, or how would they get a hold of you?
So we are housed in the Winslow office.
Okay.
So you can call any local health department and get in touch with us. So again, you can call me. My name is Darcy, and I'm in Winslow, and you can contact me there at 928-289-6837, or you can call the Sholo Health Department here, and they can transfer.
Okay, and then they can set it up, and
Yep.
especially the Matter of Balance one. That sounds like it
Yeah,
would be
and we
fun.
offer it throughout the county. So it's not something that just has to be in the Sholo area or Pine Top. We can do it in Heber, Overguard, Snowflake, Taylor, Holbrook, Winslow.
Yeah, I'm going to get something together for you with
All
the
right.
community garden. So
Yay, I'm excited.
Yeah.
We could do it in the garden.
Yeah,
There
I
you
think that would
go.
be great.
The weather's getting beautiful. Why not?
That's awesome. It is. It is.
Yeah.
I enjoyed the rain yesterday, so I didn't have to water.
Nice.
I didn't mind that. But well, Darcy, thank you so much for coming on. That was a lot of information, and it's pretty exciting information too.
Well,
So
thank
it's
you.
helpful.
I always love taking advantage of this and the opportunity to get the word out to so many people in an easy way.
Thank you.
Thanks.
Thank you for watching Safe and Sound, and we'll see you next month.